The average chronic pain patient suffers for 3.5 years before finding relief. These 5 treatments cut that down to months. I'm Dr. Sudhir Rao, triple board certified in pain medicine, anesthesiology, and functional medicine. One of the 5 treatments has no needles, no pills, and no recovery time, and it's been called Fringe for years. I'll walk you through what each one does, who it's right for, and how to ask your doctor about it. Point number 1. Exosomes restore the cellular communication your body lost. Exosomes used to be thought of as a distant future medical technology, only accessible to a small number of wealthy patients at exclusive clinics. But 5 years ago, things changed. Cost and access has become more within reach. The production side has completely changed now. In 2026, we can produce them in larger quantities, the cost is becoming more reasonable, and the evidence keeps growing faster than the scientific community can officially review. The reason exosomes work across so many different conditions is pretty elegant. They're not forcing your body to heal in one specific direction. Instead, they're communicating with your cells to wake up their repair systems that are already built into you. They're restoring the communication that has gotten disrupted by age and injury. When you talk to your doctor about exosomes, here's what you need to ask. Can they get the exosomes from a facility that has third-party verification? That matters because the quality of the product directly affects whether you get results. If your doctor just says, we'll try exosomes, that's not specific enough. You want to know where they're sourced, how they've been verified, and what you should realistically expect for timing. I tell most patients it can take 4 to 6 weeks to really notice optimal relief. Point number 2, stacked peptide protocols give you results that basic hormone replacement never could. Hormone replacement means measuring one hormone and adding that one hormone back. Well, that's what it used to mean. What's brand new in 2026 is how we can now stack peptides together, dose them precisely, and combine them with other treatments like hormones to get very specific results. The whole approach has shifted. We used to think hormone replacement was, we'd measure low testosterone and just add testosterone back. But now we think optimization. Imagine a patient comes in tired, not recovering well from workouts, losing muscle, and showing early signs that their metabolism is slowing down. Instead of just replacing one hormone, we now layer multiple peptides together. We look at the whole picture and say, your testosterone is lower than what you need for your goals, your cells are not producing energy as efficiently as they should, and you're taking longer to recover. Here's a peptide combination designed to handle all 3 of those things at once. The science is solid, the doses are becoming more standardized, and people have access now. From replacement to optimization, from measuring one hormone to understanding the whole hormonal system. When you're talking to your doctor about peptides, ask this. Are you measuring where I'm starting and then checking my progress every 8 to 12 weeks? If the answer is no, then you're not getting precision medicine. You're getting guessing. If you're hearing about any of these for the first time, subscribe. I cover these treatments in depth on this channel and explain what the evidence actually says versus what the hype says. Now let me tell you about the 3rd treatment, the one with almost no barrier to get started. Point number 3, non-invasive frequency therapies work because your cells are built to respond to them. Now this one is spreading faster than the others because there's almost no barrier to getting started, and it doesn't involve any needles or pills. Plus, patients can actually feel it working fairly quickly. 5 years ago, people thought this was fringe, but now in 2026, actual research is consistently validating how and why it works. The real power shows up when you understand the mechanism. Your body's evolution relates directly to modern electromagnetic disruption. Outcomes become predictable when protocols are research-based instead of random. 3 questions to ask. What is photomodulation and how does it reach deep into your cells? How does your body's evolution relate to modern electromagnetic disruption? Why do outcomes become predictable when protocols are research-based? Photomodulation means light frequency therapy. Certain wavelengths of light go deep into your tissue and turn on the energy factories in your cells. You're not swallowing anything, you're not getting an injection, you're just exposing your body to light frequencies that can help your cells make more energy more efficiently. Your body actually evolved in the Earth's natural electromagnetic environment. But modern life, modern buildings, and all the electromagnetic noise around us has changed that environment. Pulsed electromagnetic frequency, also known as PEMF therapy, brings you back to those natural frequencies your cells are built to work in. The biocharger is a machine that generates specific frequencies based on these same principles, and it combines multiple approaches together. I use it for patients with chronic pain, anxiety, people who aren't recovering well, people who have low energy, and people whose metabolism seems to be slowing down. A patient comes in with chronic low back pain, and we add photomodulation and PEMF to their treatment plan. Their pain drops 30 to 40% in 4 to 6 weeks. They recover faster between treatments. Their sleep gets better. The adoption curve is going up because people are actually feeling themselves getting better. Point number 4, Basivertebral nerve ablation treats the source of pain, not just the signal. For a long time, if you had chronic low back pain that didn't respond to physical therapy and injections, your options were pretty limited. More injections, more therapy, or spinal fusion surgery. But in 2026, we have procedures like basivertebral nerve ablation that can address the actual source of pain in the vertebral body itself, in the bone itself. They're minimally invasive, they're reproducible, and they give results to patients who've already tried everything else. I've treated patients who've had low back pain for over 20 years. They've tried everything. 6 weeks after basivertebral nerve ablation, they're reporting 50% less pain. 3 months in, they're doing activities they haven't been able to do in over a decade. And unlike spinal fusion, they still have full mobility. Stop thinking that spinal fusion is the only option when nothing else works. Start asking what procedures target the actual source of pain inside the vertebral body. Here's how it works. With chronic low back pain, the pain signals is often coming from inflammation deep inside the vertebral body. Basivertebral nerve ablation treats the nerve endings inside the bone that are sending those pain signals. These procedures aren't for everyone. You need the right imaging, the right diagnosis, and you need to be in the right kind of patient. But for people whose pain is coming specifically from inside the bone or the vertebral body, these are genuinely life-changing. Point number 5. Full hormone profiles show you exactly where your system is losing ground. Hormone optimization in 2026 is completely different from even 3 years ago. The old way was simple. Check a hormone, add a hormone, check it again, and adjust the dose. Now we're doing comprehensive hormone profiles. We're measuring free testosterone, DHT, DHEA, pregnenolone, cortisol patterns throughout the day, multiple thyroid markers, how your cells are processing energy, and inflammatory levels, all at the same time. We're looking at the whole hormonal system instead of just turning one knob. I had a 52-year-old patient come in feeling exhausted, losing muscle, not recovering from exercise, metabolism slowing down. Basic blood work looked pretty good. But we did more detailed hormone testing and found their thyroid wasn't quite optimized. Their cortisol rhythms were off. Their growth hormone signaling was declining, and their testosterone was in the lower normal range. Instead of just adding testosterone, we created a coordinated plan. We optimized everything, and 3 months later, this patient had 40% more energy. Tonight, before your next appointment, write down these 3 questions and commit to asking them. Number 1, are you measuring my full hormone panel, including free hormone levels, daily cortisol patterns, and thyroid subsets before I start and at regular intervals during treatment? Number 2, are you using advanced labs to track how my body is actually functioning, not just whether I'm in the normal range? And number 3, write down exactly what your current provider tests right now. If they're checking total testosterone and TSH only, write that down. That gap on that page tells you exactly what's missing and gives you the starting point for a real conversation about optimization. The quality of your care goes up significantly the moment you start asking better questions. The treatments that actually change outcomes are often the ones that doctors don't always know about yet. The practitioners who stay ahead of the curve track outcomes, understand the mechanism behind what they're doing, and are willing to adapt. You now have 5 treatments that are breaking through right now in 2026. Some of your doctors know them, some don't. The real question is whether you're going to wait for a doctor to catch up or go find a practice that's already using these tools every day in their practice. For a deeper breakdown of 3 of those treatments, specifically PRP, exosomes, and peptides, including which one is right for which problem, watch the video I put out comparing all 3. It goes into exactly when to use each one, when to combine them, and what realistic results actually look like. I'll leave the link right here.